Let's go over C1 and vagus nerve. If you've listened to any of my content, you are going to know that the C1 vertebra up top, underneath the skull, when it goes out of alignment, I've discussed that it goes forward. So forward. Now there are consequences to that, but let's discuss this one in particular. That is these two structures right here called the vagus nerve. I'm going to drop a couple resources down below if you want to read more about that, but generally for the sake of this conversation, we're going to talk about the general role of the vagus nerve, and that is the rest and digest system, or what we call the parasympathetic system. So as you could imagine, if the C1 deviates forward or anteriorly, it can create an impairment of those vagus nerves. And if it does that, then it will impair that parasympathetic system. And what that does is that puts you into sympathetic dominance. It will put you in that opposite state. Now the problem with that is that you are putting your foot on a gas pedal and you cannot stay on that gas pedal. That is that constant revved up feeling, that anxious feeling, that go, go, go feeling. Well, this is why I often talk about addressing that C1 alignment, because we want to take any stress off those nerves, hence why when we adjust, we do deviate that C1 back into alignment to take the stress off of these vagus nerve structures. This is also why I always comment where if we're looking for something like vagal tone exercises to stimulate these, which of course is meant to stimulate all the things that these nerves connect to, most notably the digestive system, because you can't be in fight and flight and rest and digest at the same time. But in addition, that it just decreases the nerve flow to the digestive structures. So it's going to affect stomach acid production, it's going to affect motility, those sorts of things. So we want to relieve that. So as I say, we can't be in rest and digest and fight and flight at the same time. So we want, again, to take the pressure off of that. So doing vagal tone exercises or even using a vagus nerve stimulator is not going to work as well as we want. Those are great things to use. We want to use those to stimulate this, but my issue with that is that if there is an impairment and these nerves are not functioning as they should, this is the first place we must address if we want those other strategies to work better. Again, they are great. It is always good to throw as many things we can at that to benefit it. But again, we want to always go in order, and that is remove the impairment of the vagus nerve first with a proper C1 adjustment, and then use the vagal tone exercises or the vagus nerve stimulators. And that is why, in order to regulate the nervous system, we want a proper C1 alignment.